Hey guys, this is Dr. Jason Tirado, your West New York chiropractor. And today's neck pain alert, we're actually going to be talking about pinched nerves that are inside the neck and just generalized neck pain. So this is what I typically hear when a patient walks inside my office. Hey, Dr. Tirado, I woke up yesterday morning with severe neck pain that radiates down into my arms and into my right hand, and I can barely move my neck without actually producing the shooting pain inside my right arm. Or I might actually hear something like this. Dr. Tirado, for the last few months, I've had this horrible nagging pain inside my neck, and whenever I look up, like this position, my arm goes completely numb. Or I might hear this. Hey, Dr. Tirado, every time I bend my head or like up and down, or if I turn right to left, my left arm goes completely numb, or my right arm goes completely numb. Or I've noticed that whenever I'm going to the gym and I lift some weights, I can only curl 15 pounds with my left arm, and compared to my right arm, I can curl maybe 35 pounds. These are all common things that I hear inside my office, and these are common histories that describe a classic pinched nerve inside the neck. So the question is, what's a pinched nerve? And to answer this, first, we got to take a look at what a nerve really is. So I've got my handy spine over here, okay? And in this model here, you can see this is a model of a vertebrae, right? And you've got your nerves that exit inside here. You can see that the nerves actually come off the spinal cord right inside here. And those nerves that are inside in the neck region go down. These nerves actually go down inside your arm, and they go all the way to your hand. And inside the lower back, the nerves that come off your spine actually travel down into your lower back, which turn into, let's say, the sciatic nerve, right? And the spinal cord, which is right here, is actually known as the network or the highway that actually brings information from your brain down into the spinal cord and throughout the body to your arms and to your legs and to the trunk area, and that's where the brain information is processed. And the bony area, these hard vertebrae inside here, that's what actually protects the spinal cord and also your skull as well. Protects it from and it protects us from any type of injury, right? So the nerves that you see inside here, right, this actually brings the information from the brain to the rest of our body, and that's what allows us to basically feel, it allows us to taste, it allows us to smell, allows us to see, and basically it also allows us to do complex movements with our arms and our legs and things of that nature. And there's always information going from your brain through the spinal cord, now through these nerves, and traveling to your body. It's constantly going back and forth, back and forth, back and forth. So the problem is that when you get a pinched nerve, the nerve inside here can actually get pinched anywhere along the spinal column, right? And if it happens inside your wrist, well, that's going to cause carpal tunnel. If it happens inside your elbow, well, that can cause cubital tunnel. If it happens inside your shoulder, you get a pinched nerve inside there, well, that can be called thoracic outlet syndrome. And if it happens inside your neck, well, or inside your lower back, well, that could be from a herniated disc, or it could possibly be coming from arthritis. Either way, all of these things result in a slowing down of information from the brain to the rest of your body. And that's where numbness gets involved, and that's where pain gets involved, and that's where strength and weakness can actually occur, right? So there are two types of conditions that typically occur with pinched nerves, which generally will occur probably in most everybody's, at some point inside everybody's life. So those with a herniated disc, which is what you see right inside here, that red spot right inside there, putting pressure on that nerve. That might happen in younger patients, it can happen in older patients, and those with arthritis, well, that could usually happen with, let's say, people over 50 and 60 where they start to get arthritis. A combination of the two conditions can produce a pinching effect on the nerves as well, and that could make the diagnosis a little bit trickier. So what happens is the nerves that exit the spine through these holes can be narrowed in the middle of right? These holes where the nerves come out right inside here can actually get smaller and smaller, right? And in the middle of the disc inside here, known as the soft jelly part, that could also herniate out and put pressure on these nerves inside here, which exits the spine. And that's where a hard bone presses on a real soft, tender nerve inside there. And that can cause pinched nerves inside here. But the good news is that chiropractors, for both of these types of conditions, pinched nerves and herniated discs, can actually treat these conditions very successfully and have really good outcomes. So that's about it for today. We just talked about some nerves. We talked about how nerves get pinched and how herniated discs and also pinched nerves, and how you can have all different types of symptoms, and how chiropractic care can really help out in those different types of situations. That's about it for today. If you're suffering with any of these conditions and you've listened to this, you've been listening up until this point, then chances are you might be suffering with a pinched nerve. And if you do, I want you to give me a call. My name is Dr. Jason Tirado, your West New York chiropractor. I'll talk to you soon.